We found out the hard way that the overuse of antibiotics can lead to drug-resistant infections. Now, scientists are questioning whether we're seeing the same result from the growth of antifungals, like the kind used to treat fruits and vegetables. You're looking at Candida auris, a fungus or yeast deemed by the CDC as an urgent threat because antifungal drugs that fight yeast infections are failing to kill it. Most of the roughly 600 cases in the U.S. are in New York, New Jersey, and Chicago, found in nursing homes and hospitals, typically striking patients with weakened immune systems. Dr. William Lee says physicians nationwide are on high alert because little is known about C. auris.
We need to figure out what it is, why it's resistant, and how to contain it.
In his new book, Eat to Beat Disease, Dr. Lee explains the best foods that strengthen our body's defenses. He says not having enough good bacteria in our gut can lead to infection, but we can turn that around.
In general, we do know that when our healthy microbiome, which is the bacteria inside our body, is functioning properly, those bacteria, our healthy bacteria, boost our immune system, our immune defenses, which allows us to fend off attacks from the outside more easily.
And Pat, unlike many yeast infections, C. auris can be transmitted from person to person and can live on hard surfaces. The CDC recommends testing for anyone who may have come in contact with C. auris, such as healthcare workers.
Oh, well, Lori, I don't exactly understand. Where did this thing, it just suddenly has begun spreading? It's this mystery fungus. Well, what's the origin of it?
Indeed, and that's a great question because doctors are trying to figure out where it came from. The first documented case was very recently in 2009 in Japan, and we saw a lot of it in India. Now it's in the United States. They're not really sure where it came from, but they are speculating, they need to confirm this, but they're speculating that it may be a result of overuse of antifungals sprayed on plants that we eat, plants that the foods we eat, and these are the antifungals that try to treat mold on these growing things.
You know, I saw someplace, and I'm just passing it on, that the statin drugs were actually initially designed to combat fungus. Is that true? Do you know anything about that?
I haven't heard anything about the statin drugs, but we know that up until this point, a lot of the times when we get fungal infections, it's because we have reduced the amount of good bacteria in our bodies. For example, when women take antibiotics and kill those good bacteria, they often get a vaginal yeast infection, which is a fungus. And when children oftentimes take antibiotics, they'll get thrush, which is a fungal infection in the throat. And in both cases, antifungal medications work great, but also, Pat, interesting, you can also treat these fungal infections by taking probiotics. They're the healthy bacteria in yogurt and in other types of probiotics.
Wait a minute. Tell me that again. We can get fungus from taking probiotics? Did you just say that?
I'm sorry if I did say that. That was a slip of the tongue. We can get fungal infections by taking antibiotics. We know that by definition, antibiotics kill those good bacteria in our bodies that typically keep our fungi under control.
Well, actually, what you and I were talking about so long, and we gave out that booklet on how to have a healthy gut, this really is the answer to this fungus thing, isn't it?
It absolutely is. We know that the good bacteria in our body keep our fungi under control. We have lots of fungi in our body. That's okay because our bacteria keep them under control. It's when we kill those bacteria, the fungi can grow up. And up until now, the antifungal medications have worked fine. Even taking probiotics have worked fine for many of these fungal infections. But and what we're seeing with the C. auris is the only people who are getting it are people who are already very sick, who have very weakened immune systems. So for those of us who are healthy, it's all the more reason to keep those good bacteria in the gut.
Thank you, Lori. Ladies and gentlemen, we want to see you healthy, and I think it's very, very important that you listen to what Lori is saying in terms, you know, here's the deal. Don't take antibiotics if you can possibly help it. Don't use diet drinks if you can possibly help it. don't take sweet and low and similar sweeteners. The only thing that you should use is stevia, because we want to make sure that that gut is healthy. And I've found this, there's something called Garden of Life. There are others I'm sure that you can find, but they're live bacteria. So when you take these probiotics, you actually are putting a little culture of probiotics, of good bacteria into your gut. And then you can feed it with what's called prebiotics. And that can keep you a lot healthier. And so many children are having all kinds of diseases, not to mention fungus, because they're being hit with antibiotics when they're little kids, and it kills all the good gut bacteria. I mean, I know you're sick of hearing about it, but this is one of the great medical breakthroughs that we've been dealing with on this program.